Hello, my name is Fiona Miller. I'm a professor at the University of Toronto and the director of Cascades, an initiative to support climate action and awareness in healthcare that's funded by Environment and Climate Change Canada. We at Cascades have connected with CAPE, the Canadian Association of Physicians for the Environment, to have this impromptu conversation with some members of the CAPE delegation to COP27 in Egypt. CAPE, as I say, the Canadian Association of Physicians for the Environment, has been in this space of climate change policy development and advocacy for many, many years. They've done important work both within Canada and internationally. And this year they have quite a large delegation, I think of 5 individuals, and a number of staff, including staff and active physicians who are there in Egypt. And we get to talk to 2 of them, Dr. Joe Vipond, who's the current president of CAPE, and he's an emergency room physician in Calgary, and Dr. Courtney Howard, who's had a long role with CAPE, is also involved with a number of international associations, and she's an emergency physician in Yellowknife. And both of them, Courtney in particular has been to a number of COPs before, including COP26 of November last year, 2021 in the UK, where the question of health systems' role in this, the extent to which health systems would need to become more climate resilient, more low carbon and sustainable, was really elevated thanks to the UK presidency of COP26, and Canada did sign on to the commitment to deliver low carbon sustainable health systems that are also climate resilient. So we as Cascades are really interested to know what conversations are happening about health systems at COP27, what conversations are happening about climate resilience, about financial supports, about reparations, all of the issues that are vital and related to health and health systems as the world tackles this great challenge. So I look forward to our conversations with Joe Vipond and Courtney Howard, and I hope you will enjoy them as well. Hello, Courtney. Hello, Joe. Thank you so much for connecting with us today. I'm Fiona Miller, as you know, from the University of Toronto and Cascades, and you're there on behalf of CAPE and many other organizations. Really interested to know why you go to these COPs, how many times you've been, why it's important for folks like you to go.
I'm just counting in my head right now. I think this is my 5th. So, as you know, the environment and health have been siloed for far too long. And when I read in the Lancet in 2009 that climate change is the biggest health threat of the 21st century, I was very surprised. Of course, my patients weren't, because I read that in Nunavik, which is already 3 degrees Celsius warmer than it was when an 80-year-old elder was born, which is resulting in unstable ice, drowning potential, food insecurity, mental health challenges, wildfire smoke, evacuations. So tons of really discernible health impact. But like so many things in medicine, I can treat the effect in the emergency department, but I can't help prevent it from there. And so as emerge docs often do, you start to want to go upstream. And that means you have to get yourself into the decision-making spaces where the decisions are being made around policies, around the allocation of funding, on the issues that are of relevance to your patients, to trying to keep them out of the emergency department. So some things we've been working on here, we actually just gave a presentation in the Canadian Pavilion this morning, detailing some of the things that have worked for the Canadian Association of Physicians for the Environment. We've been at this for over 25 years, which is a lot longer than most similar organizations in the world. So we built up a bit of a history of having been able to figure out how to be helpful. So we supported the national price on carbon. Joe in particular, and also the rest of the team were quite important voices pushing for the accelerated phase out of coal. We supported the implementation of the Canada's new food guide, writing policy briefs and doing media around the importance of a planetary health diet. And because we've been at this longer than almost anyone else, there's a real opportunity for us to come to spaces like this, participate in the Global Climate and Health Alliance work. I'm here as the head of delegation for the International Society of Doctors for the Environment, and help increase the game, help raise the game around the world at the same time as we influence our decision makers. So last year, I've heard from Health Canada that it was helpful that I was at COP in order to pressure Minister Bull to sign up to the WHO Low Carbon Resilient Health Systems Framework. This year, we've managed to make connections between the Powering Fast Coal Alliance and the Global Climate and Health Alliance, the Lancet, so that we can help other physician communities learn how to phase out coal. So looking to be helpful in ways that are helpful both at home and internationally.
Great.
Yeah, I don't have quite as complex an answer as Courtney does, because in a lot of ways, she's my mentor. I'm her mentee. When Courtney first went to Paris, I remember her vividly going, "You want to come?" And I really debated because, getting on a plane and using all that carbon to fly across the world to maybe not even have an impact, it was just so intimidating for me. I balked and I balked and I balked again. This is actually, I guess, my 1.5 thought, because last year I came with my daughter, who's 15 years old, and she was 15 at the time. She's suing the federal government for a just climate set of laws, so that when she grows up, she has a functional society and world to live in. And so I was basically her chaperone, and I was all on the outside. And I started to see why that was important through that process. And so this year, they've really dove in. We've gone from having Courtney go and kind of representing not only Kate, but all Canadian doctors in these things, to having a delegation of 5 people. We have 2 staff, the 2 of us as board members, and we have 1 member with us as well. So we've really kind of, quintupled our size, and I think we could be really effective. It's my first day, so I'm just learning the ropes.
Oh my goodness!
She already asked a really hard-hitting question of the minister, so he's getting off to a good start.
What were you able to ask?
Oh, I was just, the math is so hard on climate in Canada. With I can't remember the exact number, but it's something around 250 megatons of emissions from Alberta, and the rest of the country, like the whole country, is around 670. So Alberta alone is about 40% of the emissions for the whole country. Our emissions are climbing where everybody else's are dropping. The math is just so hard for them to get to actually accomplish anything. And until they acknowledge the difficulty of that and put in some strong policies, we're just not going to meet our end in speed. I think it's important for Canadians to recognize that, and also our government.
Right. So much to think about, I guess, just in terms of the just transition in Alberta for the people of Alberta as well. So you're both emergency physicians, and there seems to be a lot of emergency physicians that get engaged in this work. Is that a fair assessment, and why is that, if that's so?
I'll let you answer that.
It's an emergency.
We're not good at sitting still in the face of fast-moving disease. It's like this is the thing I'm worst at in the entire world. We're trained to take action in an itemized way in the face of fast-moving disease in uncertain situations. And so both of us are pretty unable to be at the site of any acute situation and not do that. It's what the world has trained us to do, and what we practice now. I practiced for 14 years. How about you?
20.
Yeah, so it really becomes a way of being, and it ends up being quite well suited to this work. It's not just from Canada that emergency physicians are overrepresented. I'd say maybe half of the docs who are really, really active in this space are emerge docs.
And believe it or not, it's the same in COVID policy as well. I think it's that ability to act without 100% of the information. A lot of physicians gather data. I want to make the exact right decision, so I'm going to wait. Whereas emergency doctors, we're kind of used to seeing a situation where we don't know everything, but we have to act anyways. And then if we don't get it quite right, we can adjust. It's quite a different approach than a lot of physicians.
Are there many other medical contingents or healthcare contingents at COP27? It seems like the Canadian healthcare contingent has been actually quite influential and important at these events. Is that a fair assessment?
Well, it used to be that there were only about 3 of us who showed up. So, the UK has to be given credit for all of the work it did in this space. I know that I think it was Durban. It was just Dr. Robin Scott and Nick Watts. And since then, in Paris, there were 100 people, I think, or so who went to the conference. What we're seeing now is just huge growth. So we have got quite a lot of learners coming in from Colorado. They've got a really good climate diploma program there. The International Federation of Medical Students Association is always one of the most well-organized players. I mean, all hail the world's medical students who essentially kept this sector going while the adults of medicine, frankly, fiddled away time. We wouldn't have a Global Climate and Health Alliance if not for medical students like Nick Watts at the time and Isabel Braithwaite. So youth have really been incredibly important. Now the adults are finally coming and we're seeing more senior physicians and senior policymakers. We were so honored today to have Isabella Tan from Health Canada join us as we presented. We know that Minister Duclos wasn't able to come because, of course, the provincial and territorial ministers meeting was a conflict. But even just having people from Health Canada here, it used to feel really lonely. I remember at COP27, I was at the Indigenous Peoples Pavilion and I was hearing impacts on food security, staple foods from Indigenous peoples all around the world. And the thought in my head was every doctor in the world needs to hear this. And I looked around the pavilion, I thought nobody I knew was there. And I was sitting beside Elder Francois Paulette, and I think he looked at me, he's like, "You okay, doc?" I guess you could tell I was tachycardic. It felt like when I have a very sick patient in the middle of the night that I know needs care that I can't provide within my skill set and my resources, and I can't get a hold of someone on the phone. That's how it felt at COP21. It doesn't feel like that anymore, which is great because our profession is smart. We're some of the most trusted people in the world. We know that the health frame from a communication studies perspective is one of the most persuasive ways of motivating people to action. We know that so many ways that we can decrease greenhouse gas emissions, reduce air pollution, save lives. And so really, I truly believe that with 5% of greenhouse gas emissions attributable to healthcare and 10% of global world product allocated by the health sector, we have a greater potential than any other group of professionals to activate the social tipping points in terms of communications, in terms of resource allocation, in terms of policies that's required to deliver a healthy response to climate change. So like having a group here to meet, to form rapport, what happens is we push people here and then we go home and we know one another. So all of a sudden we work together so much more effectively and that transmits through the year. So I think what you're going to find is you're going to go home and you'll think to yourself, oh, what did Nick Watts say about whatever? And then you'll email him and he knows you. So he'll email you back and things just go. And so part of this is that rapport building, which as we all know, humans are humans. And if you know somebody, things happen a lot faster.
I think the other thing that we're seeing is that CAPE is becoming a known quantity on the international scene, especially when it comes to coal. And, we've had a lot of successful campaigns. And so we're at that point now where our organization can mentee other organizations. So hopefully we'll be able to play that role.
Yeah, we were talking to a young doctor from Uganda today and had just had some discussions last week with the Global Climate and Health Alliance about seeing if we could help apply for some funds to steward climate-related positions, NGO in Africa. And we've got other contacts there. We met another one today. So these are the kind of things we can help people not reinvent the wheel because we did it. We reinvented all sorts of wheels and now other people don't have to.
It's been a recent Canadian meeting, a meeting of the Canadian delegation. Are health and health system issues being talked about much in that sort of context?
It's really new, I think, for a lot of policymakers to think through these lenses. From our perspective, it's really important because it really connects individuals to the climate policies in a way that talking about polar bears or frogs can never do. And so I think the policymakers are starting to recognize that frame is really useful in getting the public on board.
Can I take you back to COP26, Courtney, in particular, where this commitment was made by Canada to deliver a climate resilient, low carbon, sustainable health system? It was really important, I think, in many ways, that federal commitment. And I'm wondering in what ways that set of questions is being raised again here at COP27 what kind of conversations are happening around that commitment?
It's been very important internationally. The WHO now has over 60 countries signed up to that. And so yesterday they held a panel around the ATTACH system, which is the secretariat that the National Health Service and the WHO are partnering on to really make sure that we have a way of spreading and scaling best practices. So we know that the NHS in England is way ahead really of anybody else. They've got incredible evidence-based plans produced by the Lancet. They've got 10 years worth of data leading up to this last commitment. They've got 150 people working under them. They're central to the actual administration of the entire health system. So it's a gift really to the rest of us that they're willing to help us accelerate. And so there was a panel yesterday where John Dalbus from the US was talking about how they're going with they're partnering with the White House to make a sign-on system at the hospital level, because of course they have a lot of private hospitals there, so it's a bit different to administer. At the the public hospitals that they do administer, they're starting a program to make sure that they're an integral part of helping the government meet their greenhouse gas goals. They've got a toolkit that they're producing for both low carbon health systems and really resilience, because we know that this is partly about decarbonizing, but it's partly about supply chains. It's partly about infrastructure. It's partly about making sure we have electricity supplies for our hospitals that can withstand extreme heat. So the resilience part of it, the adaptation part of it, I believe that's probably what drives me as much as anything. I have worked in humanitarian circumstances with Doctors Without Borders where we ran out of supplies. And if you've ever been in the situation where you have somebody dying under your care and you know you could save them if you just had the right tools, and that tool is not on the shelf, that's the type of provider trauma, really. Those tragedies you can't shake. Mm-hmm. And those memories and the recent supply chain disruptions that we've had with normal saline, with anesthetic drugs and pain medication, with amoxicillin, Tylenol. I mean, our entire pharmaceutical supply system doesn't work, and neither does the internet.
Super. So what are some of the really exciting things that are happening at your organization that CAPE is advancing you think are quite relevant to all the work happening at COP27 and elsewhere?
Well, it's been a stunning growth for CAPE over the last 3 years. We've gone from literally having one staff to 15 today, and that's in like 2.5 years, which is incredible to contemplate. We actually had an announcement today, which is really exciting for the organization. In June, we launched a fossil fuel ad ban campaign, basically using the analogy of cigarettes and how cigarette ad bans was really important in decreasing the social acceptability of that product. We have an analogous campaign saying that we should be advertising fossil fuels, and we need government regulations for that. As a component of that campaign, the organization filed a Competition Bureau complaint against the natural gas lobby that said that they had these advertisements saying, the gas is clean, switch the gas to the clean solution. And we challenge that because burning natural gas is not clean. There's no way it's clean, not only from an air pollution perspective, but of course from a GHG perspective. So we had that accepted by the Competition Bureau, and we announced that today. So that's one of the exciting things that's happening. There's so much.
Are there some final words about what we should be looking for from COP27? What do you think we might see on the health and health system front coming out of COP27, or what are you hoping for?
We're looking for some really strong financial commitments around loss and damage. We know that health systems get taken out by storms. We know that water systems get polluted. And of course, lower and middle income countries who have done the least to cause the problem are experiencing the worst impact. We saw those floods in Pakistan recently. I mean, as a high income country, we're lucky Minister Vipond has been a bit of a champion at the high income country level of loss and damage. So I would love to see it made a permanent agenda item to have a financing facility that is able to distribute funds with attention to healthcare facilities. what we need to see in Canada, I think, is a secretariat to help us coordinate work with the provinces and territories and the attached units so that we're taking information from international bodies like the NHS and working together to make sure it's spread across Canada again, so people aren't reinventing the wheel. So that's what I'll be working on both here and when we come home, and with you, Fiona, and with everybody at Cascades and everybody in Canada.
Great. Joe, any final thoughts for us?
As I said, I'm the mentee, so I'm learning what this is all about. I know that there's going to be next week. I'm going to be kind of here by myself. A lot of the crew is all leaving, and there's going to be, I think, more Powering Past Cool events going on next week, and hopefully I can assist in, maybe sharing some of the nuggets that helped us get 3 different coal phase-out campaigns over the line. So, that's what I hope to.
It's nice to have company.
Great. Thank you so very much. It's wonderful to chat with you both. Thank you so much for all the work that you're doing. Thank you to Kate for having such a powerful delegation at COP27. Talk to you soon.
Bye.